Tonight on Scrappy Time, we're going to be talking about all things reproductive health with my good friend Tory Mills. I want to tell you something right now. It's going to be an interesting show, so you better get you a beverage and hang tight.
I watch the sun fall from a rock outcrop. The moon slowly rose and the valley filled with fog. And then I heard a commotion on the trail down below. Carbide lights were coming up the mountain, and they were led by Mother Jones singing, "Which side are you on, boys? Which side are you on?" I never wanted to leave the top of a mountain, 'cause Lord knows I love to get high. I never wanted to leave the top of a mountain unless I was headed to the by-and-by, to that mountain in the sky. The sweet
We're back on the back porch again this week. I've got a great guest and friend of mine from Planned Parenthood for Tennessee, Tory Mills. How you doing today?
I'm good. It's good to be here, Jay.
Well, thanks so much for coming by. So I'm glad you were able to come out to Rockford today and see us. So today we're going to talk about different things that Planned Parenthood offers as far as their services. We're going to talk about the attack on women's reproductive health at our state legislature. And we're also just going to talk about reproductive health in general, if that's all right with you.
That sounds great.
Okay. So tell us a little bit about yourself and what you do.
Yeah. So Jay, I work in Knoxville here in East Tennessee, born and raised here in East Tennessee. And I've been at Planned Parenthood for 9 years. And I have been several things during my career at Planned Parenthood. I was a sexuality educator for the first, I would say, 7 years of my career. But I've also been a community organizer for a long time as well. So I've actually gotten to work with a lot of folks here in Blount County, both on the education end and on the community organizing and advocacy end as well. But yeah, work at our health center in Knoxville, where we also provide health services. Thankfully, I'm not the person doing that, but got a great team there that also provides a full range of reproductive health care and sexual health care as well.
Well, tell us a little bit about those services, because I think a lot of folks really don't know the service that Planned Parenthood provides, and it's very broad. So
yeah, absolutely. So Planned Parenthood, like you said, we provide a full range of services. So oftentimes when folks think about Planned Parenthood, they think of abortion, and we do provide abortion services. We're proud to do that. But we also provide a really wide range of other health care. So birth control, pap smears, life-saving cancer screenings like breast exams, testicular cancer screenings. We provide STD testing and treatment for folks. That includes HIV testing. We've got folks who are really up to date in the HIV testing and treatment world. It can help folks get connected to care in that realm as well. Here in East Tennessee, we provide, as in our other regions, we provide health care for transgender and gender nonconforming folks, as well as the rest of the LGBTQ community. And that's really important because there's a big need for that care, especially here in East Tennessee. And so we're really proud to provide those services and have been for the last several years.
So how many, I know there's an office here in Knoxville, but tell us how many Planned Parenthood facilities or affiliated facilities are across the state?
Yeah, so Planned Parenthood has 4 health centers across the state, 2 in Memphis, 1 in Nashville, and 1 in Knoxville.
Okay. And so the folks that come into a Planned Parenthood facility, I'm assuming there's a lot of folks that come to seek services there that don't have insurance, but would if we expanded Medicaid in Tennessee. Can you elaborate a little bit on how expansion of Medicaid would help lots of your clients.
Yeah, absolutely. So we know that there are so many Tennesseans who have fallen in what they call the coverage gap, right? Where, they, if Medicaid were expanded, they would qualify for that insurance. But because they don't, they're, in this gap of not being able to qualify and not being able to pay for, other insurance care. And we know that that impacts a huge number of Tennesseans. And definitely, we see that, of course, in the people that Planned Parenthood serves. I think it's really important to think about what we as a state are saying when we don't expand Medicaid, right? We are saying that, you don't deserve health care unless you can afford it. And most of us can't afford the health care that we get, right? So when I think about reproductive health care, a pack of birth control pills can be cheap, right? But what do you do when you need a full, a visit, when you need to actually have a pap smear, you need, you find a lump in your breast and you need an exam, right? Those kinds of services can be very, very expensive, especially for somebody who's uninsured. So I think, I hope that our state legislature continues to think about what we're saying to working class Tennesseans when we haven't expanded Medicaid. And we're one of the few states in the country that hasn't expanded Medicaid.
And we're talking about hundreds of thousands of Tennesseans, not just a handful. And these are working people, and we should give them the health care they need to prevent accidents and diseases so we can keep them in the workforce. So that's great that y'all offer those services, because I'm sure some of those would be completely almost inaccessible in our normal healthcare system because they're not insured and don't have the access.
Absolutely, I agree.
So let's talk a little bit about some stuff that's happened at the state legislature the last few years, but I guess specifically they passed a 6-week abortion ban, which, as you and I know, is completely unconstitutional, but our state legislature doesn't really care about that, obviously, because they're trying to make a point. What point are they trying to make?
Yeah, they're trying to do a couple of things, in my opinion, with a piece of legislation like this that is absolutely on its face unconstitutional. First is that they have higher stakes in mind. Our Tennessee state legislature was quite clear that they want to challenge Roe v. Wade, that they hope that this challenge will go all the way to the Supreme Court. And I think Tennesseans need to be very aware of what the ulterior motives are. It was hard to hear when people said, well, this law is going to get deemed immediately as unconstitutional. Well, yes, and we've got to look at 10 years down the road, 5 years down the road, and about what this means. And I think the other thing here is that our legislators at the state level are continuing to chip away access, right? So Roe v. Wade may protect the legality of abortion access for now. However, access for most people has been really unavailable for a long time, right? So when you think about poor pregnant people, when you think about pregnant people of color, when you think about people who live in rural areas, right? These folks have not actually had access to abortion or other reproductive health care for quite a while because we have made it so difficult to access these services. And I think that our state legislature, we have just seen them continue to really chip away at actual access for Tennesseans in Tennessee to make their own decisions about their pregnancy.
So when we talk about Roe v. Wade, that's the famous court case from 1973 that established that abortion is a legal procedure as long as it's before viability. In Tennessee, how do we define viability from a legal standpoint, or at what point in Tennessee do we perform abortions?
Yeah, that's a good question. In that, so there was actually a law that passed a few years ago that said in Tennessee abortions cannot be performed after 20 weeks. And I think this is important to talk about because there's been a lot of conversations about abortions that happen later in a pregnancy, and it's so much just misinformation, and not even just misinformation, just falsehoods about that and what that means. And I think, what I always talk to people about is abortion is a complicated issue, right, for a lot of folks on a moral level. And I understand that. And I think where we all need to be on the same page, though, is making sure that we're reading from the same set of facts. So I really encourage people, if you don't know much about what abortion actually entails, to read about it, to look up, medical sites and to learn and understand what it is. It may not change a person's mind about how they feel about it morally, but again, I think we need to at least all be having the same conversations on a factual level.
And I think when you say misleading, all we have to do is watch it be described by politicians on TV and various things, when in actuality, most of the abortions in Tennessee are performed how?
Yeah, so there are a couple different types of abortion procedure, and one that is the most commonly used is called the medication abortion or abortion by pill. It's not the same thing as emergency contraception, by the way, which as a former sex educator I have to make sure to separate those two things. But yeah, so it's a very the most common way that folks have an abortion. It's a pill, and I think that a lot of people don't know that, and I think you made just such a good point, which is that when we're listening to these conversations that people have about abortions, it is often people in power who have not had abortions, right? We often don't listen to the stories of people who have had abortions or people who provide abortions or work in health centers that provide abortion services. I think these stories get lost and purposefully trampled on. And so I think, when we're having conversations about abortion in general, I think we need to make sure that we're listening to the folks who are most and directly impacted by that type of care.
So other than just the 6-week abortion ban that passed the House and Senate and was signed by Governor Lee, what's some other legislation that's either passed in the last few years or that's being proposed and kind of being pressured to go through the process? What's some things coming down the pipe we really need to watch out for?
I think that our legislators in Tennessee are really trying to find any opportunity that they can to continue to chip away access. And this looks like keeping an eye on what's going on in other states and trying, all these different laws. Like these laws are not unique to Tennessee. Other states in the country are also trying different things to ban abortion. And so I do want to say that the number of laws restricting abortion access have just skyrocketed in the last few years. So as you and I both know, back in 2014, voters in our state narrowly voted to amend our state constitution to say that nothing in it protects a person's right to abortion. And after that change in our constitution, that really opened the doors for the Tennessee state legislature to start passing all kinds of laws that they couldn't have prior to that. And what that means, unfortunately, is that a lot of these laws don't have a scientific basis. They often have really problematic and not well thought through pieces to them. So, for example, something that was attached to the 6-week abortion ban law this year is a piece around medication abortion reversal. So folks out there may have heard, because this misinformation has kind of bubbled up in the last few years, that there are ways to reverse, quote unquote, a medication abortion. So unfortunately, the science out there that does not back that up, there's not very much research on this. And one of the last clinical trials that happened was actually halted midway through because it was putting pregnant people's lives who were trying this reversal procedure at risk. And so I think what this contributes to overall is that we're seeing that our state legislature doesn't care if we're putting folks' lives at risk. They want to appeal to folks who are opposed to abortion, right? And they also, I think the other thing that's happening that's so interesting is that they are actually not in line with the majority of Tennesseans. They're, very recently we were looking at abortion support in Tennessee, and Tennesseans overall believe that abortion should be safe and legal, right? Even conservative Tennesseans. And that is because I think, as a lifelong Tennessean, that Tennesseans understand that people need to make these very private decisions with themselves, their faith, and their family, and their doctor, and not without the government dictating how they should feel and decisions that they should make about their own body and their families, right? If I could say anything to folks right now, it would be that, feel your feelings, do what you need to do to take care of yourself, and also we have to continue to organize. We have to work together. We have to build power in our communities, and the only folks that can do that and can build a country that we want are us. We're the only ones that can do that.
Amen to that, and God bless RBG. So really appreciate you coming out here today. I know, you're doing an extremely important work, and you have crosshairs on you from time to time from certain political entities in the state and across the country, but I want you to know there's a lot of us out there that really respect what you do, appreciate what you do, and when I'm in Nashville, I'll have you back.
Thanks, Jay. It's always good to be here.
Right there in my mirror, that red, white, and blue Western gray. If it hadn't been for the number 43, I could have been.
Well, there was an awful lot to unpack from that conversation I just had with Tory. Reproductive health is incredibly important, and Planned Parenthood plays such a vital role here in Tennessee to provide those services to Tennesseans that don't have access to it anywhere else. Whether it's sex education, abortion services, cancer screenings, or any of the other services that Planned Parenthood provides, I will have their back because it's extremely important for Tennesseans to get the health care they need. When I get to Nashville, you can also know that I'm going to stand with women and their right to choose. Because at the end of the day, government should not have a say on what happens to a woman's body.
Prayed the Lord my soul to keep, and that I'd see Peter when I die. And Lord, I hope you love dogs too. I think Jesus loves dogs too. As the years passed on, many dogs.
Folks, thanks for tuning in to this week's episode of Scrappy Time. You know what? We're less than 6 weeks away to the election. You want to make sure you're registered to vote? Visit the website on the screen. Next week, my good friend and congressional candidate Renee Hoyos is going to be here at the house. We're going to talk about her campaign and some issues, and we're going to have a lot of fun with these. You better stick around.
And you've been coming around a little more each day. Could you stop by tomorrow so we can play? And we'll start spinning and we'll be grinning, 'cause this love we have, it feels so good it can't be bad. Well, my morning sucked. Lately they've all been the same. That old sun comes up, that's when I start to feel the pain. Just when